World Health Organization's Director General Dr. Tedros Adhanom Ghebreyesus has declared that monkeypox has no longer a global health emergency. Now, in July last year, Tedros declared the multi-country outbreak of monkeypox virus as a public health emergency of international concern as the virus spread rapidly across the world. Here is more details of that in this report, again by Mariama Cham.
Following a meeting of its expert advisors, the World Health Organization announced on Thursday that the monkeypox outbreak will no longer be regarded as a public health emergency of international concern. Monkeypox virus, commonly known as Mpox, has led to a global outbreak of cases last year, sending shares of vaccine and treatment developers. Over 87,000 cases and 140 deaths have been reported to WHO from 111 countries.
Yesterday, the Emergency Committee for Mpox met and recommended to me that the multi-country outbreak of Mpox no longer represents a public health emergency of international concern. I have accepted that advice, and I am pleased to declare that the Mpox is no longer a global health emergency. However, as with COVID-19, that does not mean that the work is over. Mpox continues to pose significant public health challenges that need a robust, proactive, and sustainable response.
The WHO chief said integrating monkeypox prevention and care into existing health programs is recommended to allow continued access to care and rapid response to address future outbreaks. Meanwhile, Dr. Nicola Lowe, Vice Chair of the International Health Regulations Emergency Committee on Monkeypox, said there should be ongoing plans to control the virus.
The committee recognizes this need for ongoing commitments to maintain the plans to control Mpox, with a long-term goal that the human-to-human transmission will be eliminated, as well as mitigation of zoonotic transmission where possible. And that transition requires many integrated activities, which include integrating Mpox prevention, preparedness and response within national surveillance and control programs.
Dr. Rosamond Lewis, head of technical lead for monkeypox of the WHO Health Emergencies Program, said efforts must be maintained against the virus as it has the potential to evolve.
It is absolutely critically important that we continue the efforts that have been initiated already, because as we are all aware through the past few years, that as long as a virus is given an opportunity to continue to transmit from person to person, it also has the opportunity to change, to mutate, to evolve. And this is particularly true in the instance when people who are immunocompromised are affected.
Monkeypox has been established in parts of Central and Western Africa for decades, where people are mainly infected by animals like wild rodents. But the disease wasn't known to spark big outbreaks beyond the continent or to spread easily among people until last May, when dozens of epidemics emerged in Europe, North America, and elsewhere. Monkeypox most often causes symptoms including rash, fever, headache, muscle pain, and swollen lymph nodes. The skin lesions can last up to a month, and the disease is spread via close physical contact with an infected patient or their clothing or bed sheets. Most people don't need medical treatment to recover. Reporting for Eyeafrica News,